This is Doug Miles, your EMS coordinator at Star EMS, coming to you in mid-December 2023. The year is almost over, and it's time everyone talks about New Year's resolutions and turning over a new leaf. I would like you to listen to me talk about the patient signature rule for a few minutes and consider how you are applying it in your workplace. Now, admittedly, this is not the most exciting topic to discuss, so be patient. It's possibly the least glamorous thing we have to do, but if we don't do it right, it can cause a lot of trouble. The signature section serves several purposes. Obviously, it is an acknowledgement that we have provided the patient with the service. It also authorizes our company to share information with the patient's insurer so that we can file a claim and get reimbursed for the care that you have provided. Another is it acknowledges that we have given the patient a copy of our Notice of Privacy Practices, which is a requirement under HIPAA. Let's look at the different signature sections. We have signature section 1, where the patient, if they're able, signs. They acknowledge they've received a Notice of Privacy Practices, agree to billing authorization, and the HIPAA acknowledgement. And then they would sign in this section here. Now, if the patient's signature is anything less than perfectly legible, that's okay. Often, especially the elderly patients, they struggle with signing the iPad because they will put their finger on the wrong spot, or they'll brace their palm against the screen and the writing section won't pick up properly. If they can only put an X or initials or a scribble, that's okay, all right? But we should always drop down and witness that signature, okay? This is where you would put your name and not your personal address. That's okay. Put Star EMS's address, 63 Oakland Avenue, Pontiac, Michigan, 48342. And then you would sign your name to acknowledge that that was the patient's best effort at a signature. Now, if the patient says to you, "You just sign for me," politely tell them that you can't do that, okay? That is an issue because if we have EMS providers signing for the patient and the patient has multiple trips, let's say like a dialysis patient, we could have 20 or 30 versions of the patient's signature in section 1. And number 1, that's fraud. You cannot sign someone's name for them, okay? Number 2, look at it through the eyes of like the Centers for Medicare and Medicaid Services or Blue Cross or any other insurance, okay? When they look at a recurring patient that we have and they see different versions of the patient's signatures on all these run reports that we've submitted, that's a huge red flag, okay? This whole signature section is a result of the attempt by our government and the insurance industry to prevent fraud from happening, prevent people from just creating patients out of vapor and setting off medical claims. So the effort is we have to get the patient's signature from the patient, okay? If the patient cannot sign for whatever reason, that's okay. You can always move on to section 2, okay? Section 2 is where someone who is related to the patient would or has some sort of responsibility over the patient would sign, okay? Their legal guardian, their medical power of attorney, a spouse, or a relative that receives benefits on behalf of the person or arranges the patient's treatment or handles their affairs, okay? This is where that patient, person would sign in lieu of the patient's signature. Sometimes that person is not available and there's no one able to sign for the patient except whoever is receiving the patient at the facility, okay? In that case, we'd go to section 3 here. You would sign the first section, and then someone from that facility. It doesn't have to be a nurse, okay? A lot of nurses will insist that they have to sign for the patient in this case. They don't. It could be an LPN, it could be a clerk. All we're looking for is someone who is employed at that facility to acknowledge that they saw this patient delivered. This is a real live patient, and we're not just, again, creating people out of vapor and filing claims. So anybody can do that. If they work for that facility, they can sign this section. Okay. Notice that in both cases of section 2 and section 3, there has to be a reason the patient can't sign. All right. Not just that it was inconvenient for you to ask the patient to sign. There has to be a legitimate reason, like if the patient has dementia and they can't sign for themselves because they don't understand how, or they've had a stroke and they don't have the the muscle control to sign. If you put the patient was confused, all right, make sure that that jives with what your vital sign section says, because I've seen many times providers put the patient was confused, they couldn't sign, and had someone else sign for the patient, and just guess what the patient's Glasgow coma score was? Right, 15. So understand that it is vitally important that we not sign for the patient, even if they say it's okay to sign section 1. Okay? If the patient is unable to successfully sign, they can only make a scribble. That's okay. We're just going to witness that that scribble was their best effort at a signature. And again, if the patient is unable to sign and can't communicate or whatever, then either an authorized representative or a third party from the facility will sign for the patient. If you've been doing it incorrectly, this is your chance. Turn over a new leaf. It's a new year. You want to move forward and get signatures the proper way. And remember that you don't have to wait until the end of the call to get that signature. You can get that signature at the beginning of the call. Often patient's family are in the room. They're available to sign before you leave. And then after you've left with the patient, you might discover the patient has difficulty signing. So grab that signature at any point. In the beginning, it's just fine. That's all I got, guys. Thanks for listening.